Hello and welcome everyone. My name is Stephen Spinello. I am a second year MPP student at the Harris School of Public Policy, and I am a current Fellows Ambassador to current Ambassador James Bennett at the Institute of Politics. Today, we're very fortunate to have not one, but three mayors from across the country joining us. Mayor Richard C. Irvin was elected the 59th mayor of Aurora on April 4th, 2017. Mayor Irvin was born and raised in Aurora and is a graduate of East Aurora High School. He also holds a BA from Robert Morris College and a law degree from Northern Illinois University. A veteran of the U.S. Army, Mayor Irvin served in Desert Shield and Desert Storm. He has taught at Robert Morris College, Northern Illinois University, and as a substitute teacher at East Aurora School District 131. Mayor Irvin is a former prosecutor for Kane County State's Attorney Office. He also worked as an assistant state's attorney for the Cook County State's Attorney's Office. Mayor Nan Whaley attended the University of Dayton and later settled in the Five Oaks neighborhood where she and her husband Sam reside today. First elected to the Dayton City Commission in 2005, Nan was the youngest woman ever chosen for a commission seat. She was proud to be elected as Dayton's mayor in 2013 by a double-digit majority. Nan is a national leader among her peers, serving as the second vice president for the U.S. Conference of Mayors, as well as the chair of the International Committee for the conference. Nan is also a founding board member for the Ohio's Mayor Alliance, a bipartisan coalition of Ohio's 30 largest cities. Additionally, she is a four-time delegate to the Democratic National Convention. Mayor Woodward was born and raised in Washington State, worked her way through college, graduating from the University of Portland with a Bachelor of Science degree in Communications Management. After arriving in Spokane in 1990, Mayor Woodward has a 28-year career as an award-winning broadcast journalist on local television. She reported on Spokane issues from the change in city government to a strong mayor system, the revitalization of downtown, and the challenges of growth and development in the city's neighborhoods. During her television career, she made the Spokane community the focus of her work and was awarded the prestigious Silver Circle Award from the National Academy of Television Arts and Sciences. Finally, today's discussion will be moderated by Washington Post reporter Lena Sun. Lena is a national reporter for the Washington Post, covering health with a special focus on public health and infectious disease. Lena graduated from Cornell with a BS in communication and a master's degree in journalism from Columbia University. A longtime reporter at the Post, she has also covered a variety of beats, including the Metro Transit System, immigration, and education. She has also served as the Post's Beijing bureau chief. Lena won a Pulitzer Prize for national reporting for her coverage of the war on terrorism, part of the national reporting team in 2002. Recently, Lena's reporting has focused on the ongoing public health crisis. So without further ado, please join me in welcoming all of our panelists today.
Hello, everybody, and thank you for joining us. Thank you, Stephen. And so today we're going to have this great discussion. Thank you, Mayors Irvin, Whaley, and Woodward. It's going to be a 1-hour program. We'll start with about 40 minutes of discussion, and after that, we'll be taking questions from the students. This is to remind students, if you would like to submit a question, you can do so by using the Q&A portal at the bottom of your Zoom screen and anytime. And students will have the option to ask their question live on video, or if you would rather not appear on video because you're still in your flip-flops and t-shirts, I'm happy to read the question. So we'll get started. I thought it would be start by letting each of the mayors answer this very general question, and then we can dive back in. So don't go on for too long, and then we can go into some of the specifics. We've been talking a lot about the coronavirus, the federal response. Everybody's seen the headlines of how the United States is a total basket case federally. But it would be interesting to hear from each one of you, what is it like at your level dealing with real issues, navigating how to deal with this public health crisis while you have budget cuts, you have to deal with furloughs, you're dealing with other issues. And I thought I would start with Mayor Irvin, because your state is in the considered uncontrolled spread of COVID. Maybe you could start, and then maybe we could go to Ohio and then end in Washington. Go ahead.
Well, absolutely. Well, first of all, thanks for having me on. It's very good to see everyone. And I look forward to good conversation about COVID and how municipalities or cities deal with the COVID response and just the pandemic in general. It seems like when this started back in March for Illinois is when we had our shutdown, March 16th to be exact. It seems like eons ago that first happened, where we were locked in our homes, wondering what was going to happen. And matter of fact, right around that time was when I was diagnosed with COVID myself. So I experienced early on, the uncertainty of this novel disease that was, spreading through our country, at light speed. And I can just tell you, it was nothing nice. But because of that experience, I recognized what I had to do as a leader here in the city of Aurora. We're the second largest city in the state of Illinois, over 200,000 residents in the city. I recognized what I had to do and my responsibility to just get the word out and let people know, regardless of what was coming from our president, what was coming from our governor, what I needed to do locally. And I think, there's an old saying in politics, all politics is local. The reality, of all the executives in our government, whether it be president, mayor, president, governor, mayor, the mayors have the closest contact with people every single day. So because of that, I used the contacts that we normally have to just let people know what was important. Let them know that, it was important to social distance, wear masks, and these new things, constantly use hand sanitizer, wash your hands. These things that were being newly introduced to our community that we needed to do to protect ourselves, protect our family, protect our friends and our community members at large. And so we set out on we set on a campaign, just letting people know, this is what we need. We need our citizens, our residents to do here in the city of Aurora to make sure that we protect all of ourselves from each other, and protect our families, so we wouldn't continually spread this disease, COVID-19. And, I think we did a good job. Internally, we launched a virtual emergency operations center, which we were constantly on call with all of our first responders and our executives throughout the city. And then we worked with our governor to come up with free COVID testing. We've tested over 70,000 residents, and not just residents, people that come out from our suburbs. 70,000 tests so far. We're doing 1,000 tests a day, or have the ability to. We did this effort called Mask Up Aurora, where we purchased here locally and got folks to donate tens of thousands of masks, which we gave away to our residents, especially those residents, our seniors, our students, and our lower income population that might not be able to afford them. We gave $16,000 of masks our very first day within an hour and a half. We've used we have this thing called CDBG money, which I'm sure our mayor's community development block grant money. We took some of that money out of where we normally would use it, and we provided our residents with rent relief for those folks that, and a lot of folks throughout the country that because of COVID, aren't able to make money. So a lot of folks lost their jobs. We also assisted our small businesses by providing $1.4 million grants to our small business to help them get back on track, as well as, reaching out to our community. So I won't take up too much more time, but we've just done a lot to reach directly to our residents, the citizens, because we have the closest contact of any executive in all our branches of government. So I want to use that.
Mayor Whaley, so maybe I could narrow the question down a little bit. So, you run a city, like Mayor Irvin said, he had to take stuff from one pot and put it into coronavirus. Maybe it would be more helpful to talk about the challenges. What are the things you're juggling? What don't you have resources to do because of the local response and the local needs? And it'd be interesting to hear what the frustration is like for you as a mayor in terms of getting relief from the state or communications to the state. And we won't even talk about the feds.
Yeah, there's no real action from the feds that's really been helpful. We had a call with FEMA a few months ago when we were one of the hot spots, first round of hot spots, Dayton and I think El Paso, and they asked what they could do, and I was like, the president to wear a mask and not have this whole back and forth with a mask would be super, super helpful. Just the messaging has been so difficult. For us, I think, in addition to what Mayor Irvin said we're doing all of that work, it's really this, healthcare, this, keeping people safe, and then the economic impact that you have to really balance that's really, really difficult. And what I've noticed over the period of the 6 months is I feel like the people are really like a frog in water, right? So it kind of boils and boils until it's really hot. And you have to remind people that, hey, it's, yes, this weekend in Ohio had the highest number of COVID cases yet today, not lately, but yet. And, when you consider in March and April that we closed the entire community and state down, but now we're like figuring out how to get people in football stadiums, I get the sense that it's not really about what's safe and what's healthy. And certainly we've learned a lot over these 6 months about COVID, about how we can try to have a safe economy, but it's really, I think people are trying to, accommodate what they want to do rather than what they should do. And I think that puts our job as mayor in a really tough situation, particularly as we're seeing congregate spread. And we know now too that, most of the people that will die from this are people that have, something else wrong or are old. And so, I think that because we're learning more and more about it, it's making it more and more difficult for people to really, I think, do what's best for the community as a whole. And that puts us in a really difficult situation. And then add to the fact that we, have significant economic issues coming down, particularly for cold weather states in this fourth quarter, and, small businesses that frankly just aren't going to make it. And so for me, I've just tried to keep a North Star of health first, and it's not been popular. But I think it's really, really necessary. We talked to the 7 cities of Ohio that are the large cities in Ohio. Unlike Illinois, we have quite a few of, population spots. And so we talk to the governor twice a week. And frankly, I think he started out very, very strong, but it's been pretty disappointing these past few months. Again, because I think both the pressure from the right is wearing him down, and then also the economic impact of what this pandemic is holding for communities. And both are painful, but one is deadly. And so that's really my attitude about it as we continue to balance this message. And I think for mayors, we have this entire year of 2020. I think you could write a story of what did mayors do? They stood in the gap. And so they stood in the gap around health and economic issues on COVID, and they stand in the gap around civil unrest and First Amendment rights, right? So we're in these places as local leaders that are really, really uncomfortable and really, quite frankly, unpopular, but very, very necessary.
Thank you. Mayor Woodward, do you want to take a stab at that? I mean, I'm interested in less the sort of list of things that you've done, but as Mayor Whaley was sort of outlining the juggling that's going on. And, in Washington State, of course, was hit hardest early on. And they've done a much better job of sort of keeping it under control. But I think in your city, there's a major, the outbreak is all in the long-term care facilities. And I guess maybe if you want to take a stab at, Americans are so tired of hearing the same things over and over again. And there's so many people who just don't believe because they haven't had a loved one get sick, or like in Mayor Irvin's case, have a personal experience. My mother died of COVID, and she was in a senior living place. And she died at the end of April, but the guidance on masks kept changing, and there's not been any coherent messaging. So talk about what it's like in your corner of Washington, where they've had good success, but now you're seeing this local uptick. And how do you convince people to listen? Because, in your neck of the woods, you got a lot of folks who just do not believe in science.
Well, that's the challenge, Lena. Especially for Eastern Washington. As you mentioned, the state was the epicenter initially for the coronavirus, but we saw most of those cases on the west side of the state. Spokane is on the east side of the state, tends to be more conservative on the east side. Spokane is the second largest city in the state, more than 200,000, but we're also a regional hub for the economy, for healthcare, for jobs, for all arts and culture, entertainment. So in the city of Spokane, we were hardest hit when we closed in March. We closed middle of March, was a statewide shutdown. And our jobs predominantly rely heavily on hospitality. And that industry has been hit extremely hard. And because most of our job losses fall in that category, we had a tremendous amount of people who are unemployed. And right now we're in phase 2 of a 4-phase statewide opening plan of our economy. And we've only got restaurants at 50% capacity. The weather is changing. We've had incredible fall weather, but this week the weather's bad. We've been able to increase capacity for those restaurants and some of those businesses outside. That's not an opportunity right now. So how are they going to make it? We also have some of the poorest zip codes in the state in Eastern Washington. And these are people who have those hospitality jobs that are minimum wage jobs, and they are hurting greatly. So it's been extremely challenging. We did issue, the state did, a mask mandate. Was a hard sell in Eastern Washington. I'll just tell you that right now. I still have a number of constituents who contact me daily and say, Mayor Woodward, defy the governor's shutdown order, open up the businesses, because our livelihoods are at stake. Yes, this is a health pandemic, but the economy of their lives is their livelihoods. And they're losing everything that they've worked their entire life for. It's a tough conversation. We've actually had a few counties in the state of Washington try to defy Governor Inslee, and they were slapped with orders from the Attorney General that they would lose all state funding if they continued on. And so, I'd love to be able to open up more, but it's just not possible right now. And really in the state of Washington, the mayors have no authority whatsoever. And even the opening process, it's the county commissioners, it's the health district, it's the health officers, and it's the hospitals. But as you mentioned, we have had an uptick in cases, whereas early on, our case count was extremely low. That's why Spokane County was the largest county at over 500,000 people to get to phase 2, where we're still in after 3 months. But it's been an incredible challenge. We've had just under 180 deaths. And as you mentioned, 65% have been in those long-term care facilities. We should have been protecting those facilities much sooner because they're our most vulnerable. But it's been difficult. It's a tough conversation in Eastern Washington to convince people to mask up, to convince them to not gather in large groups. In the holidays, we always see an uptick because that's what happens. And then you've got the businesses who say, we can't even survive on 50% capacity. Our profit margin is 6%. We're barely making it right now. If we can't advance, we will shut down permanently.
So I just want to take this. I have one question to follow up on the business side. And, it's not either health or business, right? So if people feel confident in going to a restaurant or going to someplace, they will do so. One of the things that's been effective in other countries is, the whole public health idea is like, if you're sick, right, you have to stay home and stay away from other people. And the other people have to stay safe. But in the United States, there's not any support for quarantine, right? So let's say I'm an essential worker, I work in a grocery store or a meat packing or something like that. If I had to stay home, I'm not getting support, I'm not earning any money. But in cities and countries elsewhere, if they provide like a hotel and if they give these people like a voucher and meals, sort of like jury duty, like civic duty, you are going to stay home and you protect public health, then people do it. Is that something that your cities would have resources to do so that to sort of bring the disease down, or do you think that that's not something that would go over well in selling to the public? Mayor Whaley?
It would be incredibly difficult to fund that right now. I was going to add to Mayor Woodward's point. I think one of the unfortunate parts about this health versus the economy, because we're not seeing federal help, it is becoming health versus the economy. And so that could completely be taken away if we had significant help. I mean, this pandemic is like a natural disaster when it comes to local governments. It's not because, you know, Aurora didn't do something right and so suddenly they have COVID. It is, you know, upon all of us. And so, you know, the real loss, I think, is the loss of the federal stimulus, particularly this last round, because particularly those of us that are not in the Sun Belt, we're going to have some really tough economic fallout from that. And that's going to make people more angry around the health restrictions. So I think, Lena, to your point, like, yeah, those are great opportunities. There's no funding for that. We're talking about, you know, we've already cut about $10 million out of a $180 million budget in Dayton. We will do another $10 million for 2021. So we're talking about actually cutting police and fire services and really direct line services. So there's just no ability to do that because we have no support from the federal government.
I'm assuming that the other two mayors probably don't have any resources for that either. They said all the budget sounds strained, right?
Yeah, well, we do have an isolation facility that we have had since the very beginning. You know, when Spokane really got into this early in February because we had 4 coronavirus patients who were transported to a hospital here because we have a pathogens unit that could take them, 1 of 10 in the country. So we were kind of thrust into this early. So we ended up setting up an emergency operations center regionally within our county and all the cities within the county. That was the way that we decided to do it. And early on, we identified several public buildings that we could use for our homeless because we had, through physical distancing, had to increase capacity in our shelter system, as well as isolation and quarantine facilities. And we currently use a hotel for that. We have not really had an issue with convincing people to isolate or quarantine. We did have 1 or 2 cases where we had to involuntarily isolate someone who was a problem in the community. And that's something that our regional health officer directed, as he is the authority in the state of Washington and in our region for responding to this pandemic. But that part of it hasn't been hard. I will tell you the part that's been hard is our county in Eastern Washington borders Idaho, which is fully open. And we're only 30 minutes away from that border. So we have people going back and forth constantly. We've lost business to Idaho because they're fully open. And we lose business all the time because of that. So that's been another one of our challenges. Plus, we have casinos on sovereign land that have been open since May. And we've got one casino that has 1,000 people in it every day. And people aren't masked. And people are in close quarters. They're inside. People of all ages. They're drinking alcohol. They're staying for hours on end. But we, interestingly, have not seen community spread or super spreader cases there. So we hear, you know, best practices changing. We see 1,000 people in one facility every single day, but there's no community spread there. So our residents are having a tough time hearing all these things, balancing everything, and choosing what's best for them. So
yeah,
that's our challenge.
That sounds terrible. That sounds so tough. Mayor Irvin, do you want to jump in here and talk about?
It would be almost impossible to support financially, you know, the ability to take people out of the economy and to pay for them to stay sheltered. And even if we were to ask that locally, you know, I don't know how well that would go over.
Right.
Because I don't know that any mayor could just make that decision on his or her own. You know, we need other politicians or other city council members to all agree with that. And I don't know that I would get a consensus for that. But let me just say, you know, whenever something like this happens, I think the average person is always, at least from what I see from our perspective, looking for someone to blame. Whose fault is this that our business, you know, isn't able to be open? You know, whose responsibility is it to make sure that I get the money that I need to, you know, to pay my family's bills and to maintain my employees and my business as a whole? And when you have individuals in charge, executives like mayors and governors, oftentimes we get the brunt of that, where, you know, it becomes our responsibility. You know, for example, you know, I always think that, you know, when I say to, you know, business in my city, you know, if you don't make sure that people are complying and wearing masks and social distancing within your establishment, there's going to be consequences, you know, there's going to be fines, possibly closure in conjunction with our health department, working with our health department. But I get blamed for that, and it becomes, something that I did wrong to these individuals, instead of recognizing the only reason that I'm doing this at all is to protect our community as a whole. And with as Nan pointed out, Mayor Whaley pointed out, when we have these differing messages coming from, different governors of different states, and our president that doesn't necessarily say the right thing, doesn't say the right thing, and doesn't enforce masks, doesn't enforce social distancing, and has, these large events, while COVID is going on, it makes it difficult for us to govern locally and make sure we protect, our residents and citizens here at home.
So I just wanted to switch the question over to something else that I've been following, and of course it's going to have a ripple effect down at the local level. At some point, the federal government is going to approve a vaccine for coronavirus. If it's safe and effective, then this federal group called the Advisory Committee on Immunization Practices will make a recommendation to the CDC director and then the feds as to who should get the vaccine first when they have limited doses, maybe 10 to 20 million. And it will depend on how effective the vaccine is. Like if it turns out to be really effective in ages 65 and older, they'll say recommended for nursing homes or whatever. When the federal government gets ready to send it out to the states, it will be up to the states, each state, to decide, okay, in my state, I think the healthcare workers should get it first, and then maybe teachers or other essential workers. Are any of you being clued into what your state's plans are? Because those plans have to be turned in this week. And the federal government is going to decide based on, population, prevalence of disease, comorbidities, and, like where the nursing homes are. So I'm imagining Florida probably would get a lot because a lot of nursing homes are in Florida. So I was just curious how clued in you've been, and maybe we'll start with Mayor Irvin.
I've been in touch with the governor regularly throughout the pandemic. However, we have not spoken yet on, once the vaccine is approved by the federal government, how it will be prioritized as far as folks receiving that vaccine. But I will say that in the conversations that I have had with other mayors and had with the governor previous to this, based on this vaccine becoming so political and seemingly forced to be done at a certain time, I don't know how many people are going to be ready and standing in line, especially if we talk about giving it to our first responders first and our healthcare workers and frontline folk. Those are going to be the people that are almost like, and I hate to say it, almost like the guinea pigs, because we're not really sure, based on the fact that this has been made so political, whether or not this is the right thing to do. Now, we all want a cure, we all vaccine, we all want some mitigating way to deal with this and make sure we save lives. But because this has become so political, it becomes a difficult issue. Who is going to be first in line, and are people going to be willing to accept this vaccine?
Well, so does that mean that every state is supposed to be setting up their own task force or advisory committee, and hopefully you're a large area, large city, there would be parts of the state where they would decide this is where it should go. So has that not happened in Illinois?
Not yet.
Okay, well prepared. Okay.
And I'll just say that I haven't heard anything on that matter as well. We are anticipating that it would go to those essential workers first, the first responders, healthcare workers, possibly teachers. But I have even had some of our union members get a hold of me and say, are you going to require this of us? Because if you do, I choose not to vaccinate myself. Will I lose my job?
And these union workers are what industries?
Police.
They don't.
City workers want to know if this is going to be a mandated vaccine from the city.
And let me just jump in. I don't mean to cut you off, Mayor Wiley, but I just happen to be in one of those states where the president has identified as a blue state, where the communication with the governor and the president have not been the best over this whole pandemic. Matter of fact, the president has identified him a number of times on national television as one of the failing governors, even though he's done everything he can in the circumstance to protect the citizens of Illinois. So some of that may be the lack of communication with a state that is not a state prioritized by the federal administration.
State of Washington would fall into that category as well.
Yeah, state of Washington definitely on the bad list.
Right.
How about you, Mayor Whaley?
Yeah, we've been working on this for the past 2 months and have gotten updates. We have an emergency preparedness tables. And so someone from the city really leads that regionally with other regional leaders. So, when we were trying at the beginning of COVID, to manage PPE, personal protective equipment, that was driven there. And then I was very excited when they decided to start planning around vaccines. So probably started around August. And so I've gotten updates around, like you said, Lena, like the different pockets, like based on how many vaccines. I mean, there could be multiple vaccines that get through the FDA, which ones go where. And we do anticipate vaccination to start in January. That's what we're planning here. Look, I mean, I'm very hopeful about it, and I hope people mandate it. Frankly, I think that most people will end up taking it. I think there's a lot of discussion now about not taking it, but after 10 months in your home, if your choice is to stay in your house or like take the vaccine and get on, I mean, frankly, I've not been too impressed with Americans' self-discipline, so I'm expecting them to take the vaccine to get on with their life. And so, and I count myself in that. I look forward to it and look forward to my turn at the vaccination, because I still trust, even with the insanity that is at the top of the federal government, I do trust the FDA and the CDC, and quite frankly, journalists' leadership in this and putting sunshine on it. And I'm following it very, very closely because, I really want this to work, and I want to be a messenger for it to work too. And so I think that's really important, an important job for mayors across the country.
I want to talk about trust because that is so key right now, and it has the lack of trust in our federal institutions has so tainted the entire process, and it's unfortunate because and I see it firsthand because I cover the CDC and my colleague covers the FDA, so that even though the scientists are doing stuff and the timetable, because of the way distribution works or the science works, comes out to be November 1 or November 2nd, because the president goes up on his platform and starts spouting off, things that are blatantly untrue, then it raises this question of, oh, well, I'm not, either people say, well, I'm not going to do it because he is pushing it. And at the local level, the mayors are the ones who have to sort of bring that message home. What have you found works best in trying to find trusted messengers in the community, whether it's faith groups or other community groups, to try to help you get the correct message to people? Mayor Whaley.
So I think, this deficit of trust is a big issue in our governments, and a big issue, particularly because everything has a conspiracy theory on social media. So we're not just talking COVID, we can talk about voting and anything, basically anything that the government has its hand in, there is a conspiracy theory to line up among it. So I look at it as a more broad issue around building trust. And I'm like, let me be clear. I'm concerned overall about vaccination messaging. Back in July, when it said like half of Americans wouldn't take the vaccine, reached out to the folks at Bloomberg and other groups to say, hey, we've really got to figure out how to message this well, because you want to talk about something that's going to hold up the economy. People not taking the vaccine will definitely hold it up pretty significantly. And how do we build trust into that? So, what we've done and what I've tried to do in that arena is, number one, we do have a Republican governor. I'm a liberal Democrat. So finding ways that we can both message together. And the 7 cities of Ohio have liberal Democratic mayors. So we find a common ground to both say the same things and kind of work that direction. I know it's a crazy idea in this topic of American politics, but we do that in Ohio for the benefit of our communities. And then the second thing is, really having legitimate conversations every single week during COVID through Zoom. One is with the nonprofit providers of our community. Every Tuesday at 10:30 is a call, and every Tuesday at 10:30 is myself and the public health commissioner communicating exactly what's going on that week. Every Friday at 8:30 in the morning is our clergy call, which has actually grown over the 6-month period, not only to have clergy in Dayton, but the entire region get on. Number one, because it's a place that they have trust that they can get an answer around this issue. And number two, for us to really move things that we need the community to know about. So I think, if we just did that yesterday, the trust has been built over that period of time. And I think that's really important for mayors to do and local leaders to do, is to continue to build. And then when something is wrong, this isn't just like a rosy picture. For example, there have been times like lately that I've disagreed with the governor on being too lax in this. So the trust is, I'm going to say that too, right? And so there has to be a building of the authenticity of the voice of local elected officials. They just can't rubber stamp everything else. Trust will be lost.
Excellent. Mayor Woodward?
Yeah, I would say trust is a real issue for us too, because we have so many people who don't believe the mask mandate should have been issued to begin with. Some just outright refuse to wear masks. And I, being a conservative with a liberal governor, when he came over here, we supported everything that, he wanted to do. We've been supporting the mask mandate since day one, but getting the buy-in from our constituents has been extremely difficult, especially when they can go over to Idaho, as I mentioned, and it's kind of a free-for-all. But we have to keep that message going. We have to build that trust, and we have to find that alignment wherever we can. But that has definitely been a challenge. Our biggest alignment has been with the businesses. And our argument is, you may not like wearing a mask. I don't know anybody who likes wearing a mask. But if it means that our businesses can get open sooner and we can instill confidence in our constituents, go with the mask, right? And
very easy.
It's a behavioral thing. It's changing behavior is not easy. But it's an easy thing, I think, to be able to do to support people who need to get back to work, our businesses that need to stay open. And really the authority, or I should say the responsibility, has kind of fallen on them, not accepting customers who won't wear masks. That's been hard. And why should it fall? They're already struggling. Right. And so whatever we can do to help support them, wearing masks, that's been our message from day one.
Mayor Irvin, and then I had a question about if you had a realistic wish list money-wise of, what it would take to sort of, you'll have different problems. Like Mayor Woodward, I feel for you because, you have this bordering state, and that's true for if you look at the patchwork across the country. But before I forget, I wanted to get Mayor Irvin's thoughts on trust and how do you build that, especially in the African-American community that already is disproportionately hard hit by the disease, disproportionately make up more of the workers in essential workforce, and already have a distrust of vaccines and, don't have as good healthcare access.
And distrust of the government,
in general. Yeah.
I'd say trust is a major issue because I guess we don't know what to trust. Do we trust that this is a hoax and, it'll go away soon, or that, what our healthcare officials are saying, that this is a serious pandemic, the likes of which, we may not see for another 100 years, that could, kill millions of people. Well, what do we trust? Do we trust, what our president is saying, and that, this isn't that big a deal, and we're going to get past this and don't worry about it. Don't let it beat you or get you down? Or do we trust our medical personnel that say, look, this is like Armageddon. We see folks coming into the hospitals, every day, and a lot of them not making it out at all. Yeah. So I guess just the question here, which is unfortunate, is that we've had two totally different, diametrically opposed sides saying that, we're right, which we know that, they're not. And then we're this side over here saying we're right. And so the question is, what do we trust? Now, as far as, our citizenry, we have 42% Latino population, 10% African American, and all of our minority population lives in the center portion of our city, and that's where we have 47% of our COVID diagnoses. That's where we have the largest amount of deaths. So absolutely, it's hard to build that trust and to get them to believe what one person is saying, the mayor here, because I'm local, I'm the one they see every day. So I think it's incumbent upon me or any mayor in the city to decide, this is what I'm going to tell people, this is what I know is right, and this is what I've got to convince people to understand and to believe, and hopefully, and hope that they get on board with me. I hope we've been successful doing that here in Aurora.
So, but what specifically are you doing? Are you, I mean, part of it is transparency, right? We don't have transparency from the federal government, but if locals are having regular press calls or regular information, it's important for local officials to say what we know and also what we don't know. That's how you build trust.
I've created that, I've been using the heck out of Facebook Live, where I personally go on myself, and I've talked about what it's like to have COVID. I've talked to the superintendents we've got 6 different school districts in Aurora. We've talked to superintendents about what's going on with the schools. We've talked to the hospitals and CEOs about the reality of COVID and how many people are getting sick every day. We've talked to our Congress people about, the relief packages coming out of the federal government, if we're going to get another CARES package. We've talked to food pantries and had a number of those folks, talk about the lack of folks having food. I've personally been on, these Zoom calls and Facebook Live sessions where we spend, hours just talking to people and letting them know the reality of things, talking to students about how they feel about, what's going on and whether or not they look forward to going back to school or want to, take the chance to go back right now just because, our president's saying go back. So it's important that I'm out there letting people know what's going on, what we're dealing with, and asking them what do they think we should do to go forward.
Okay, I have a follow-up question for you, but there are 2 students who have questions, but it's one thing for you to go on Facebook Live, but are you doing anything regularly by reaching out to church groups or holding meetings? Like Mayor Whaley was saying, every Tuesday she does this, every Friday she does. I mean, of course, every city is different, but it's one thing for you to do it because it's a personal, but another for all of the elements of society to know, okay, the church, you can't just go to the church leadership when you need them,
Right.
They want something from you.
Luckily, we created that foundation already, and it was already in place, luckily for us. So reaching out to those folks and letting them know and spread the word, amongst their organizations was something that we did immediately and continue to do.
So let's see. I'm going to make sure if I do this right. So the first question is going to come from student Nish Sinha, and he will ask this on camera. So Nish, if you want to go ahead and ask the question, I think you know what to do.
Hi, my name is Nish Sinha. I'm a student at the college. I'm currently on campus in a dorm. My question was, how has COVID affected your city's homeless communities, and what aspects of your response have been successful or maybe unsuccessful?
I could go ahead and start. We have, since March, have expanded capacity within our shelter system because of COVID. We have used a number of our identified public facilities. For example, we had a shelter stood up in our arena for 3 months. We just were able to, with COVID CARES Act money, purchase a building so that we could expand our capacity for homeless. We have had incredible success when it comes to actual cases. I can count on one hand the number of cases that we have had in our shelters because our health district has been so proactive and twice daily goes into the shelters to make assessments, take temperatures, and then quarantine or send anybody to the hospital that would need care. So we have had an incredible response. I've talked to mayors who, because have had to let their homeless out onto the street because they couldn't afford to physically distance and increase capacity. We've been very, very fortunate in that area.
Yeah, I just echo one of the things that we did was with funding, with CARES funding, we did the take a hotel over so everyone could be in individual rooms. And I've done that with our homeless population to, again, mitigate spread and community spread. So Dayton and Ohio does not have, the homeless issue is very different in like all parts of the country. So it's not like we have a very large population of homeless compared to other communities. So we were able to do it that way by putting everybody in individual rooms. That really helped combat it. And secondly, I think, you know, the hotel that we took over was pretty grateful considering, you know, of the travel conditions.
We have the second largest homeless shelter in the country, Hesed House here in the city of Aurora. And we had an outbreak there early in the pandemic. And based on that, we had to remove hundreds of people from this homeless shelter to hotels, similar to Mayor Whaley, what she just stated, and actually do a deep cleaning of our homeless shelter, and recognized, similar as Mayor Woodward just said, that our homeless shelter was not large enough to house all these folks in social distance. So we have used $1 million of our CARES Act money to expand the homeless shelter and the services to make sure that not just the folks that had been receiving services from the homeless shelter are able, but all those folks we expect in the future that, because of the economy, are going to become homeless. So we are expanding that and hopefully doubling the capacity right now, recognizing that there will be a need for our homeless support for our homeless population.
Okay, so the second question comes from student Raul Subramanian, and he will ask on camera. So Raul, you can go ahead and ask.
Thank you so much. Hi, my name is Rahul. I'm a PhD student, and I use models to predict how diseases spread, infectious diseases spread in populations. And I wanted to ask you, who do you turn to for advice? For example, some of this advice might be from your local public health department for questions like, how many people should you test or whom should you test? But whom do you turn to for help with some of the logistical questions that might also be challenging, such as how do you actually get enough testing capacity or make sure that people have enough masks and get stopgap financing for small businesses, et cetera? And how useful or not have mathematical models been in helping you answer some of these questions or figure out where you need more help?
It's a great question. Great question. I wish I could tell you that we've used a lot of mathematical models during this, and we just haven't, because basically what gets funded is what is allowed in the CARES funding rules. And so the federal government has made this not the easiest process. I know you're all shocked, but that has been really difficult for us, particularly on trying to help small business out, right? So we have, you know, listened to the community, said, oh, there's a real need here. How can we get that money to them through the rules of CARES, has been really the discussion model that we've used. Now, your point about who you listen to, I think, is a really good one. You know, I don't ask the public health commissioner where we should do the economic issues, right? He is the person I go to ask if there was an outbreak at the Trump rally, or do we contact trace this bar or restaurant? Those kind of questions are in his purview. But certainly our economic development team that stays in touch really regularly with small business. So immediately when the pandemic started and we closed so many businesses, we were in constant communication again to make sure that there was this feedback loop of hearing what the needs were and then how we could help endeavor to fill them should we get funding. The CARES funding for cities under 500,000, and none of us on this call I think are over 500. There's 38 cities in the country. So the rest of us then in addition got the money to trickle down, and it trickles down from state to local. And so one of the other challenges we had around the CARES funding was, for example, we got just our last chunk of it 2 weeks ago. And by the way, it must be spent by November 26th. So just imagine the kind of turn. And I'm very proud of my staff because we knew it was coming. Like we thought it was coming. Like, okay, how are we going to spend this? Because I am not sending a penny of this back. Like that is, you know, I want it to be spent in Dayton. We will figure out a way to spend it in Dayton. Hired consultants to make sure we spend it. because it's just so important when there is so much need. But because of that, it's not like we could do much mathematical modeling if you're looking at the turnaround time that we're dealing with.
Now, I will say that we have used data and evidence, which has been key in identifying hotspots for the purpose of contact tracing. We will continue to use data and evidence in our mathematical, models to determine the spread of it and how to address it. And it's always going to be for the purpose of contact tracing, so we can make sure we remove someone if for some reason they do have the virus and need to stay away from everyone else. And as far as our CARES Act money, we've only gotten a small portion of it. We're in one of those communities where if your county isn't over 500,000, we got to get money directly from the state. Luckily, we've got 2 counties that are over 500,000, but still we haven't gotten the large majority from those counties, and we don't expect we're going to get any money from the state anytime soon, even though we've got to spend ours by December 31st. So as far as the modeling, we'd like to do modeling, a whole lot more modeling. We have been using data and evidence as much as we can for the purpose of contact tracing, but we need to use it a lot more.
And I would echo that too. We all of our decisions are data driven, predominantly though coming from our regional health district. As I mentioned, our health officer is the authority during this health pandemic, but we've been able to make a lot of decisions on our own. The city of Spokane received $10 million in CARES Act money. We've allocated all of that already, had a very vigorous process for doing that. The county, which is over 500,000, received $91 million. I understand that there is still money on the table. They are working to get that out too. And even in this health pandemic, when we've got budget cuts, my budget for 2021 is a priority-based budget. So we did include a new division, department head, and that is economic development. So that we didn't have an economic development department, if you can believe that. We have, development services, but that was something that I identified right away as being extremely important, as this economic recovery from COVID will last years.
Great idea.
So we have 2 minutes left. I just wanted to know whether there was any one thing that you felt what you wanted to get across that you think hasn't come across either in your response or the larger discussion or the need, and start with Mayor Whaley.
Yeah, I mean, I think this has been a great conversation, and appreciate getting to be with Nadine and Richard during this time. And thank you, Lena, for moderating. Look, I just think really, what happens on these issues is it all ends on the ground. And so we're dealing with a lot of stuff that is out of our control, that has been driven nationally or even internationally, and it's on us to figure it out. What's frustrating, especially during this pandemic, is just how little resources we're really getting for that help, and how difficult that is from, not lining up communication, messaging, funding. I mean, you name it, it is like the wild, wild west, and it just didn't have to be this way.
Mayor Woodward?
Yeah, I would echo that. Being in Eastern Washington, when all the attention early on went to Western Washington with COVID and the lack of testing that we had over here and the flow of information, it can always be better. But I'll just say that, we're extremely resilient. We find a way to get through these things. We become innovative and creative. If it's not coming to us, we create it. And so I'll just say that I'm very proud of our region. And I think most people, I hate to say this, have gotten COVID fatigue. They really want to get on the other side of this, but we all have to do our part, so that becomes sooner rather than later.
And I don't know if we have time to have Mayor Irvin give one last comment before we get cut off, but why don't you try?
I'll just say that, the mayors have stepped up. We're never supposed to be put in these circumstances that we even put in, but mayors all across the country have been stepping up to make sure that we continue to fight this and win this battle against COVID-19.
Well, thank you very much. I mean,
Thank you.
I think that you all have given really, I appreciate the candor, and frankly, I actually have gotten a couple story ideas, so I hope you don't mind if you hear from.
I saw notes. I saw you writing notes.
I was like, oh, I didn't know she has to like get this done in November 26th. Okay, that's. I mean, in fact, I think our economic team probably should do more. I mean, since like small business is so key, and it sounds like the rules are
arduous, yeah.
You know, and you can't go around them, but it's the key to so many things. And also, I think that if you were able to turn around small business, you might be able to get that sort of wave of people feeling better, and the more sort of social and cultural feeling like, okay, you know, that store is coming back, or these people are coming back, and people are able to resume something close to normal. I just have one last thought. Is anybody having a hard time also with flu hitting same time as COVID?
We've done a lot of messaging and a lot of work on that around getting, you know, I'm sure we've all taken, I mean, pre-COVID, nobody cared that I gave blood. Nobody cared if I got a flu test or a COVID test or a flu test. But now anytime someone puts a needle in me or something up my nose, there's cameras there. So just trying to
spread the word. Exactly right.
Message, all of this has been the key, or particularly around the flu. So
and we do have to lead by example.
Yes, you have to lead by example. Right. And so I will end on there, leading by example, and with the one person in this country who is not leading by example. That's just a fact. Yeah. Thank you all so very much. And I may be in touch for story ideas. Thank you very, very much.
Absolutely.
Bye.
Okay. Bye now. Bye, Nan.
Bye now.